In this video, we will describe the requesting and prescription of blood components. Within New Order Entry, select Blood Transfusion. There are three options for an adult, neonate or paediatric patient. This patient is an adult, so select the adult plan. In the orders for signature, blood transfusion adult appears. Go ahead to sign that. The first item visible is the TACO checklist, which is mandatory. We then confirm that we have taken consent from the patient to administer blood components. This will be recorded on the blue front sheet of the old paper blood transfusion documentation. If a patient has two valid group and screens, we do not need to repeat this, but we can request the group and screen here if necessary. There is then the request to the laboratory to provide the blood components, followed by the prescription here. This process is the same for fresh frozen plasma, platelets and cryoprecipitate. We can also prescribe medications to go alongside the blood. In this example, we will choose some furosemide. Initiating the plan allows all of these to be requested. We complete the TACO checklist. The patient has no risk factors for blood. We then get an alert asking us to check the sample validity of the group and screen. Here we select the type of furosemide we wish to administer. In this example, we will select 20 milligrams of intravenous furosemide, and these are our items for signature. This is the prescription for the first unit of red blood cells. We describe the duration that this is to be administered over. We'll select 2 hours. If there are any special transfusion requirements, we can identify these here. This is for the nurses to be aware of. We complete further details. This is for the second unit of blood. Again, we'll give this over 2 hours, and there are no specific requirements. This is the prescription for the furosemide. We do not wish to give an extra dose now. This is just for the single dose to be given alongside the blood. This is the request to the laboratory to provide the blood. Enter the clinical details. We then describe the volume of blood required. We will select 2 units. For a paediatric or neonate patient, we will describe the volume in mils. Date and time, and then the particular indication for transfusion. Indications here include indications for all blood components, so we will select the one that is most appropriate to our patient. Transfusion location is a free text. Here we inform the laboratory of any specific transfusion requirements. If there is more than one requirement, hold the control key, and that will allow you to select multiple items. There are no specific requirements in this patient, so we can select none. There are no more missing details required, so we can sign the plan.